I'm Maureen O'Connor, president of Palo Alto University. Palo Alto University, or PAU as we're known, is dedicated to addressing pressing and emerging issues through research and training in the fields of psychology and counseling. It's my pleasure to welcome you to our webinar series, At the Forefront of Mental Health. In honor of Veterans Day, today's webinar focuses on supporting the mental health of veterans and their families. We have assembled an incredible panel who will be sharing both their personal and their professional experiences with us. Dr. Kristins Background is a combat veteran and a PAU alum who has pursued a career in psychology to help fellow veterans. And Ashlynn is the daughter of a combat veteran whose family worked to help her father and other veterans get the mental health care they needed. Ashlynn is now pursuing a psychology degree herself at PAU. Our third panelist who will be moderating today's discussion is clinical psychologist and renowned PTSD expert Joseph Ruzek. The founding director of PAU's Early Intervention Clinic, Dr. Ruzek served as director of the Dissemination and Training Division of the U.S. Department of Veterans Affairs National Center for PTSD and is co-editor of 2 editions of Cognitive Behavioral Therapies for Trauma and a contributing author for the National Center for PTSD's Iraq War Clinician Guide, among many other accomplishments. Dr. Ruzek, thank you for taking the time to address this important topic.
Thank you, President O'Connor. And welcome everybody, and thank you for joining us for what promises to be a very meaningful and we hope practically helpful discussion in honor of our veterans on Veterans Day. Let me start our discussion today by setting the scene very briefly for us. We all know, of course, that military deployments are now understood to affect military personnel in very many ways, very complicated ways, often for the remainder of their lives. Some of these ways are terrifically positive things, as when an individual is able to take pride in supporting their country and demonstrate great personal resilience and fortitude in coping with the many challenges of serving. For many veterans, however, some aspects of military service, especially when it exposes them to traumas like firefights or the death or injury of friends or great human suffering, those things can affect their mental well-being long after a return to civilian life. Some veterans develop now recognized problems, well-recognized problems, such as post-traumatic stress disorder or PTSD and depression, and these things can make the transition back to civilian life even more difficult. These emotional problems, in turn, can increase the risk of suicide or lead to development of alcohol or substance abuse problems. It's also true that very many of the current issues that we are experiencing in American society are also likely to be affecting the need for greater mental health support for our veterans. For example, the emotional pressures associated with COVID-19 that we're all experiencing, the feelings for many veterans about the Afghanistan withdrawal, media coverage of political and or racial conflicts, which have been quite current in our society. These are all things that have turned up the pressure on veterans as well as civilians. So in this conversation, we plan to cover several very practical issues of importance to veterans and their families. First, we want to talk about what are the kinds of challenges that are likely to be present for the veteran who has served, and what are some of the obstacles to finding the best quality assistance that there might be out there. We're also going to discuss what happens in mental health treatment to give you a better idea of that, and how families can support their veterans as they're receiving counseling. And finally, we're going to share some of the very best resources that we think will be especially helpful to you. So joining me in my discussion today are Dr. Kristins Background and Ashlynn Steinball. Both, as you have heard, are wearing dual hats as both psychologists and also as individuals who in their personal lives who've experienced issues related to military deployment or the deployment of a family member. Kristins, could you start things off by telling us a little bit more about yourself?
Sure. Thank you, Joe. And thank you, Dr. O'Connor. And thank you, everyone, for watching and listening tonight. Dinner time is on the West Coast right now, I think. So thank you for that. And then on the East Coast, it's almost bedtime. So I appreciate everyone being here. So as was mentioned, I'm a combat veteran and I deployed to Afghanistan in 2012 to 13. Prior to my deployment, I received a master's from the University of Colorado, Denver in counseling psychology and counselor education. After my deployment, my perspective changed a little bit, and I knew I wanted to work with veterans, seeing the issues that my peers and myself were facing upon transition back. So I received my PhD from Palo Alto University in clinical psychology. And during that time, I also received a master's in public health degree from Johns Hopkins University. And this was to look at issues with veterans on a large scale, specifically suicide. I recently separated from the Army Reserves as a staff sergeant, and I'm currently working at the VA Center of Excellence for Suicide Prevention in Canandaigua, New York. And I'm a health systems specialist there, which means I focus on developing, disseminating, and evaluating national training and education programs aimed at preventing and reducing veteran suicide.
Kristen, I know from my 26 years working in the VA that the National Center of Excellence for Suicide Prevention is a really very important national resource for vets and their families. Could you take a minute and just tell us a little bit more about what the center does?
Sure. Yep. The VA established the Center of Excellence for Suicide Prevention in 2007 with the overarching mission to prevent morbidity and mortality from suicidal behaviors among veterans by using a public health approach. So this center is comprised of an interdisciplinary team representing diverse fields such as public health, psychology, psychiatry, epidemiology, health communications, health services, economics, sociology, nursing, and social work.
What an exciting place to work.
Yeah.
Thank you, Kristen. Ashlynn Steinbaugh is our other panelist. Ashlynn, could you tell us a little bit about yourself?
Yeah, of course. Thank you, Joe. And thank you for everyone for joining. So a little bit about myself. I am the daughter of a retired Army Special Forces medic. I grew up in Fort Bragg, North Carolina, where basically the military culture was all I knew growing up. Once my dad retired, we moved to Oregon, where we started a nonprofit for veterans called Forward Assist. And currently I'm in California pursuing my PhD in clinical psychology at PAU.
Great. Thank you, Ashlynn. And we look forward to hearing about your perspective because it's such an interesting experience that you bring to bear. So let's get started now by talking a little bit more about what are actually the challenges faced by veterans and their families. And Kristen, perhaps we can start with you. What issues stand out for you as being especially important from your perspective?
There are a lot being invested in this quite a bit, but one that I'll hit on first is the issue of veteran suicide risk. So in 2019, there were 6,261 documented suicides among veterans, and that equals about 17.2 veterans dying by suicide per day, which by comparison represented about 13.7% of all suicides among US adults in 2019. To put this in perspective, about 7% of the population right now are veterans out of the whole population. So something I wanted to hit on is that when we see in the media, sometimes we hear this 22 veterans are dying by suicide per day. Right now, or in 2019, it was 17.2. And then you hear something about rates. And so I wanted to take a quick minute to talk about the difference between numbers and rates. Because when we saw that it went from 22 veterans dying per day to 20 to 17, these numbers are headed in the right direction, but sometimes the rates go up while the numbers are going down. So why is that? So the reason that is the rate is a percentage. So if you think about it as 1 over 100, that's 1%. So we'll think about it that way. So the number of overall veterans has been declining because of the Vietnam era's population getting smaller and dying from natural causes. So I'm going to give a quick example about how to calculate a rate. So let's say in 1980, there were 1,000 people in a population, and 10 of those people died from heart disease. So if you do the math, 10 over 1,000 is 1%. And that's 10 people dying from heart disease. Now let's look at today. People from that population, now it's 100 because of natural cause. That's over 40 years. People could have died from natural causes. So now there's 100 people in that pool. And let's say 5 people die from heart disease. So the number went down from 1980 from 10 to 5, but the rate went up because now it's 5 over 100 or 5%. So that's just something to think about when you're looking at the numbers, and you can kind of get a sense yourself about how that's looking. But it is promising that both the rate and numbers are decreasing as of 2019. And hopefully we can keep that going in the future. And it's still an alarming rate, though, if you think about it, about 17.2 people dying by suicide per day in the veteran community. Moving a little bit into research in suicide, there's another study that just came out last year that they're finding that within 6 years of transition out of the military, people are dying at a higher rate. So it's a really critical time in those 6 years after transition to kind of catch those people and see what we can do. And I'm hoping we could talk more about that.
Great. So this suicide issue, let me just ask you to comment on it. What is it in your mind that leads so many veterans to be at a risk during that critical period after discharge of suicidal thoughts and actually committing suicide? Do you have a sense of what actually might drive it? I think often that's hard for many people to grasp.
Mm-hmm. There's many risk factors that go into that, and we won't go into all of them today. And there's also several theories about that are coming up. One potential is the fact that people are more isolated when they're outside of their community. So as a reservist myself, coming back from deployment as a reservist, all of my buddies went their separate ways across the United States. Active duty could be the same way too. So they get back in their units, but once they leave, and I'm sure Ashlynn can speak to this, it gets pretty isolating too. You don't have that community to come back to. So I'll just hit on that one for now, and I'm sure more will come up as we progress.
Great, thank you. Ashlynn, what jumps out you, given your experience as a particularly important problem for the returning veteran?
Yeah, I think a challenge that really jumps out at me has to be, communication with family members and friends. I think often a lot of people don't know how to talk about hard things or how to even, start these conversations, right? I think this can kind of lead to a lot of stress, a lot of emotional difficulties. And, often there can kind of be a disconnect between veterans and civilians, right? Kind of two different experiences. And often, we found that they might feel misunderstood when trying to communicate, or even hesitant or reluctant to really talk about things, whether or not they want to, it's out of protecting themselves or protecting others. And, I'll be talking about my personal experience a bit today, but I do just want to acknowledge that, I know other people's experiences can be different. So it's not kind of a one size fits all. But especially when veterans are kind of making this transition back into the family life or the family lifestyle, they might feel like a stranger in their own home or distant from family members. I think one of the big reasons, aside from the transition, is communication. They might become distant, avoid each other out of not knowing how to have these conversations. And as a child of a veteran, you found oftentimes that you might blame yourself, or you might find yourself acting out and not knowing why, because, the family dynamic kind of changes when, your parents gone for so long and then they come back, right? So it can be difficult to stay connected and to communicate effectively. I remember for the longest time, my mom was convinced that my dad had like selective hearing, right? Where he would hear in one sentence something about a snack, but miss the part about taking out the trash. And it actually created a lot of communication problems where we thought he was ignoring us, or he, just didn't want to talk to us or wasn't hearing us. And so we grew frustrated, and it created a lot of stress. Later, we found out, he sustained multiple traumatic brain injuries. So that was a bit of that piece. But there's also this piece of processing where when my dad would first come home, we didn't really know what that looked like for him or how to navigate that. How, especially as a kid, we want to just kind of be all over him and be like, Dad, guess what we did? Like, this is what happened while you're gone. But like, sometimes they're not ready for that right away. And so we kind of had to learn through communication and patience and collaboration to provide this space. And so it took kind of a learning curve to figure out how to communicate effectively with each other.
Yeah, I think it's helpful to view it as a transition where not only the veteran is having to learn, but the family members having to learn too, and the friends and colleagues of the veteran are having to learn new things. And you highlighted, Ashlynn, this issue of things having changed for a person when they come back. And this idea of reacclimatizing to civilian life is a real big deal for a veteran who has served overseas. And Kristen, I know that you have thoughts on that. Anything you'd like to add about what the challenges that have to do with reacclimatizing to kind of ordinary life away from military life?
Yeah, I think to stay on the communication aspect of that, I know my parents are online too, so they might get a chuckle out of this now. It wasn't so fun at the time. But when I came, so my parents can attest to some of this. While I was deployed in the Army had a program that sent parents and family members to a different state, put them up in a hotel, and over the weekend taught them some skills to help with their transitioning service member upon return home. And so they gave them skills, the chaplains were there, they had all these resources available to them. So two events kind of stick out from this. When I was overseas, I remember an incident had just happened on our base, and I called to check in after about a week, and my father asked me, so what's your favorite song now? And I'm thinking in my head, what? We just had this incident. I don't care about this whole song thing. This means nothing right now. So that was one thing that didn't really hit, but something that did hit, and a skill that they did learn. And this, Ashlynn can attest to this when she talked about patience, is when I came back, my parents were living in New York. I was living in California. My parents came to visit me for a couple of days. And I will say that I was not the best host. So when I was there, and I would kind of go off and hang out with my buddies, anything but being around my parents. When I was home, I was not pleasant. I was really angry. I didn't even know myself who I was. And so when I did talk, it wasn't pleasant. But my parents, very unlike them. So my father's 100% Italian. My mother's mixed. So they don't usually keep quiet. But they did, and they kind of just took it. And for me, I felt more and more guilty for this, because I'm like, I'm treating my parents horribly and they're just being patient. Like, what is this? And I wanted to say, I'm sorry the whole time they were there. And I just couldn't get the words out. And finally, as I was driving them to the airport, I kind of squeaked that out. And I was like, I'm not going to cry, but I'm sorry. And they walked out, got on the airport. And I talked to my mom later on about that. And she said she was really thankful that I had said something at all, because she thought she had lost me at that point. But it was kind of that patience on both of our parts. And that's kind of how we got through that.
Well, thank you for sharing that. I do think you're right that infinite patience is probably required of us all dealing with such a difficult thing as this. And I just want to pick up on something you said. We talk about all this disconnect between being back home and being overseas. But part of it is driven by the emotions and the reactions of the person who has returned, especially if that person is dealing with a lot of painful war memories and PTSD. So, for example, people with PTSD are having a lot of memories coming up, reminded by things. They just come in spontaneously, and they are very distressing. So if you are walking around having terrible memories that are activating your body and upsetting you, you start to become an expert in trying to avoid talking about anything that will bring up those kinds of feelings. People who come back, also part of PTSD syndrome is having a lot of negative beliefs about yourself, about the world, self-blame, guilt of different kinds. And like you just said, maybe added guilt now about how your behavior is affecting your family. You can have difficulty experiencing positive emotions. Irritability and anger is actually a symptom of PTSD, as you described, sleep problems. So all of these things make it hard for a veteran with PTSD to have good relationships and fit in with the civilian world. You know, you have trouble expressing positive feelings to your family members, which doesn't help. You need to stay away from reminders of what happened, and that can make it hard for you to do all the regular old things that you're supposed to do in daily life. So feeling so bad in many ways can really sometimes lead people to, to have thoughts of suicide. So we have hit on a number of quite large challenges for veterans. And we know that seeking and finding good mental health care to tackle these things will be very, very important for many people. But the getting into care can be really a difficult enterprise. Kristen, which challenges to getting good mental health care seem most important from you as a psychologist or from your own experience?
Mm-hmm. I think one is that we're kind of trained to, with this whole thing of strength, right? In the military, everything's being physically strong, mentally strong. And so the view that mental health treatment is weak, or if I say something, I'm weak. That I think is a big barrier. And as you just talked about, all those symptoms and all those feelings and all those emotions are actually a somewhat normal process for going through something really incredible. And they're rarely normal reactions to abnormal events. So because of that, I think that's, without talking about it and everything, that's a big challenge, I think, in receiving help. Just kind of getting over that, hey, I'm weak if I seek treatment. And there's also a big stigma around that. And it can really affect also, there's the thought, and it's getting better, but the thought that it can affect their career. So as I said, it's all about being physically and mentally healthy. So if I report this, what's going to happen to my career? I'm going to speak as a reservist. If I depend on that for my income, for my husband and children and all of that, and I'm going through something, I'm not going to want to say something because that might affect, like I might not be making money anymore. So that's huge. And also the retaliation and getting picked on for it. That could be something too that could be a barrier. But again, just to say, like, real quick, is that the thoughts of this are normal thoughts. So a lot of military people think this way. And so it's not, me being weak only. It's, a lot of people are thinking the same thing.
Yeah, and I'd just like to say that I know from long perspective and working a lot with Vietnam veterans that these same feelings that people served in Iraq and Afghanistan are experiencing were there in Vietnam, and actually they were there, since time immemorial when people go away to war. And you identify this issue that it's very hard for many people to acknowledge a mental health difficulty or, quote, problem, partly because of these additional negative meanings. I'm weak, there's something wrong with me, I'm crazy, I'm going to be damaged for life, as well as the fear of other people thinking these things. And it's especially hard because, few of us have had the opportunity to learn anything about PTSD before we actually experience PTSD symptoms. So normalizing and helping people understand that PTSD reactions are extremely common and are actually they're not, I don't like seeing them as a mental disorder. I like seeing them as part of the normal human apparatus for responding to terrible experiences in life. But we really need to kind of help people understand that it's not a negative comment about them, that anyone who goes through certain experiences will develop PTSD. Ashlynn, let me turn to you. I know that finding good care was important in your experience with your father. Can you tell us a little bit about your experience?
Yeah, definitely. So a bit of background about my dad. He was in the military for 25 years as a Special Forces medic, 13 combat tours, 3 Purple Hearts, 3 Bronze Stars. He did a lot, right? And so when he retired from the military, he was assigned a disability rating of 100%. And this can be assigned for both, anything mind or body, right? And for him, it was a lot of issues with like executive functioning, memory, attention, concentration, a lot of those sort of things. And so it really wasn't until his retirement ceremony where us as a family learned about a lot of the injuries, the traumatic brain injuries, a lot of the experiences that he went through. And so after this, it was really important for our family to make sure that my dad was set up with really great care, medically, mentally, everything. We just wanted to make sure that he was set up, right? And so we, without wanting to be, intrusive or kind of pushing ourselves in places we shouldn't, we worked really closely with my dad to find out, what are you looking for with clinicians? What do you want? How can we help? How can we support you without, feeling like we're kind of like attacking almost, right? And so I think this kind of goes back to communication as, keeping that open and just letting him know that we're there to support him. And so my dad was lucky to establish care in North Carolina. And then when we moved as well in Oregon, but making this transition and this move, kind of going back to what Kristen said, it's very isolating, right? We don't really live in a military community. We live far from a base now. Everything that, at least that I knew growing up was very different, especially moving from, East Coast to West Coast, everything was just different. And so living, farther and away from our community made it hard to feel connected. We felt isolated, especially my dad. Everyone, like Kristen said, that you are with, all of your friends and people you serve with, you don't have them anymore, at least physically, right? Luckily with technology, it's a little bit easier to like FaceTime or Facebook, I don't know. But really after going through like the process with, the VA, learning about how big the system can be, and also just learning about how hard it is to stay connected was really the reason that we kind of formed and created the nonprofit. We wanted to be able to help people in any way that we could, whether it was, just providing a community to bring veterans together, just to talk about, maybe they might have known each other, or just to find people in your area and to provide resources for each other. And we like to, provide counseling resources, places to go, pay for that if needed. Because like we said, it can be isolating when you're transitioning. And so bringing people together and having a strong place for community, camaraderie, all of that can really bring a positive impact on mental health. So.
Yeah, thanks for sharing that. And thanks for what you've done with the creation of this nonprofit, because there's no question one of the most important resources for veterans struggling with mental health issues are other veterans. And the isolation you're describing, some of that is because of the actual change in community or, change in your work roles and where you're employed. But a lot of it's also kind of an isolation jail that's put in place by your own beliefs and feelings. You've both mentioned how difficult it is for us all to have meaningful conversations about such emotionally powerful, private, difficult to navigate issues, right? I just want to, also note that it's hard for a lot of people, especially veterans, to believe that mental health counseling can actually help. People don't have much idea of mental health counseling. We're going to talk about it later, but the idea, especially in military groups, is I'm tough, I'm resilient, I'm a survivor, I can take care of my own problems. What is it that a psychologist or some shrink could actually do for me. No one can solve you the problems for you. And that's a barrier. In actual fact, we all live more effectively by support from other people. We don't take care of ourselves. We take care of each other. And at the other end, there are all these practical barriers like getting to out of the way places. Many veterans live in rural places or places that make it hard to get to sessions. It can be hard to get time off work. For our women veterans and male veterans, it can be difficult to get childcare to get to meetings. And this is where, paradoxically, COVID has actually increased the use of telehealth, where you can work with your mental health providers from the comfort of your own home. And that's now common practice in VA and other systems, which helps a lot. Now, we've highlighted so far some of the different kinds of obstacles to getting good mental health assistance. Some, as I've said, are attitudes we carry around inside ourselves. Others have to do with seeking assistance in large healthcare systems that, Ashlynn, you've done a lot about. For family members, seeing our loved ones struggle is extremely hard and very painful. Let's talk for a minute about the things that families might need to know to better help their loved ones, because that's a very important. I hope that we have a lot of family members on today. Ashlynn, what would you like to say, for having been a family member, what would you like to communicate to other family members about this?
Yeah. And, I think like we talked about before, it can be difficult to know how to help our loved ones, right? And so from my experience with my dad and with other veterans, a lot of times they might try to, come back and resume life as normal, right? Just jump back in right where they left off, especially if children are in the home, right? And so a lot of time they don't want to talk about anything and don't want to really, like I said, just come back as normal. And so there was, one time I'll talk about where my dad was making, I think it was like lunch or dinner or something. And I think he was like cooking hot dogs and like making sides or something. So he was boiling water. And I remember we came home and it was so weird. My dad wasn't home and the stove was still on and the pot of boiling water was basically evaporated. And we were like, okay, what's going on? And we ended up calling my dad and he's like, oh, I ran to the store to get hot dog buns. But that was like probably, over an hour later. And he was just like, oh, I'm so sorry. I forgot. I'm tired. And we're like, oh, this is kind of out of the usual for him. But we just thought, he's tired. This was before we had learned really about, his traumatic brain injuries which has to do a lot with him forgetting things. And so a lot of times there were more experiences just like this. And we had to really learn, we had to take a step back and think, what has my dad gone through? What's impacting him? And how do we approach this? And I think, we've highlighted patience and communication as kind of key. But I think it really takes, having an understanding and knowing that oftentimes like the selective hearing, he's not ignoring us. I hope he's not ignoring us on purpose and, things like that. And so one saying that we kind of developed as like a family or that we talk about a lot with my parents or our nonprofit is to talk early and talk often. So, if you notice something that kind of seems out of the usual or they're not acting right, to talk about it, right? To try to figure out how to start these conversations and do it in a way that, seems right? Because you want to be able to start the conversation and not do it too late, right?
Those sound like such hard conversations to have. Kristin, this issue of how to start the conversation with a loved one and bring up mental health care, right? And draw attention in a supportive, loving way to the kinds of experiences that Ashlynn, you had in your family is a very challenging thing for most people. Do you have any advice or pointers for family members on how to approach their loved one and launch these conversations?
Sure. A couple things. So the question when you asked it initially reminded me of the 22 push-up challenge for veteran suicide that happened a couple years ago, and you still see it a little bit. It was a great campaign in terms of reaching so many people and engaging them and making them aware of the number of suicides among veterans. But I'd like to take that a step further. So what can we do now? And I see a lot on Facebook or on social media where you're like, okay, if you need something, just call me. And so putting the onus on the veteran to call when they say they need help. And I would argue that one good step would just be to pick up the phone and call a veteran that you know. And it doesn't have to be, oh, how are you feeling emotionally? It could just be about TV shows. I love getting calls from friends that I haven't talked to about, the new Dexter series that's going to be, or just started, I think. So, but just that connection and that reaching out. So when we put the onus on the veteran to reach out, I think it's a little less effective than if we were to kind of, if we want to do something, that initial effort and just reaching out and seeing how their day is a great first step. And I know you asked me about other things that we can do. There are some do's and don'ts I'd like to share if we have a minute.
Sure.
So one, I'll start with the do's. So some things that we could do is, number one, be yourself. Being genuine and authentic is really important because you're coming from a place where it's just, if you're raw, they're going to be raw too, right? And you can just have that openness right off the bat. So no, I'll just leave it there. Remaining calm. So if you do hear something that is a little bit scary to you, think about how it is for the veteran too. And being able to hold that. So doing deep breathing yourself if you're listening to stories and trying to remain calm in these situations. A really difficult one would be to listen without judgment. And this is really hard because sometimes, saying, oh, don't judge, that's really hard to do, right? But this can be done in a way where you're still being open and just listening and using your active listening skills. And that goes a really long way. And also being positive. And that doesn't mean all sunshine and rainbows and everything's going to be great, but just reassuring them that there is help and other people have gotten help and that they can carry that forward. Some don'ts. Oh, do you want me to?
No, go ahead. Please
Okay.
go ahead.
All right. Some don'ts. And this is some that I've seen a lot. First off is don't argue. So the one thing I see is suggesting reasons why the veteran should feel a certain way. Oh, you have so much to live for. Why can't you just focus on the positives? You've done all these great things, that's not helpful in arguing. Again, it's about being open, right? Lecturing, that's a big one too. Don't lecture. Giving speeches about being grateful and the value of life and all of that. It can make the veteran feel guilty.
Yep.
Don't agree to confidentiality. So sometimes there are situations in which you might need to break some secrets in order to get your veteran help. And so don't promise something that you can't deliver. And then finally, I'll end with don't blame yourself. The only person you're in control of is yourself. And that's the same way with the veteran. And so, and it's good for your self-care too when supporting your veteran. And I took these from the VA's website. So there's a lot more information. The VA has a website, Start the Conversation, .veteranscrisisline.net, and we'll share that later on too. But these are just some of the pointers that they have on these sites, and you can actually learn how to start a conversation with your veteran.
Yeah, thanks for that advice, because I am a big believer in a family preparing for those conversations, choosing the time carefully, but thinking it through ahead of time so that we can get ourselves in kind of a position where we're more likely to be able to follow the guidance and have the patience that you've both of you been talking about, because these are heated conversations, and most of us are not Gandhi or Buddha, and can move through these conversations with supreme calm. But I do think they're important because many veterans wind up seeking mental health care in part because their families have encouraged or asked them to do it. One of the biggest motivators for veterans is to repair life with their families. And it turns out when retroactively you ask people why they got into mental health care, it's very often conversations with family members or the impact on family members is important. So I encourage us all to be willing to gently suggest going for care in a positive way. And you can offer to go along with the person. It's reasonable to let them know about different resources, like you've just heard is one of the best ones. And there's some other ones we're going to mention. It's also helpful if the veteran gives permission for the therapist to meet with the spouse or partner or family member of a veteran in mental health care. So if the veteran would like that, you can offer that kind of support in it. And if you and the veteran are aligned on that, it's good for you both to ask for that of the therapist, because not all therapists are on the spot about making that opportunity known to you. It also may be helpful for you as a family member to seek counseling for yourself or others in the family, which can help you stay more constructively engaged in the situation and help you work through your ideas about how best to help, and also help you take care of yourself emotionally. So one of the barriers, I think, to all of this is what happens in mental health counseling. Most people don't really know what happens in mental health counseling. It's kind of a weird, mysterious thing, a scary thing. Unless we've had problems or had family members problems, we don't really know what goes on there. And so I wondered if you both might share a thought about what you think it's important for people to know about mental health counseling. Kristen, you want to start?
Yeah, I'll start. And I'll start by talking about VA services right now. So if you're looking for mental health services through the VA, I first want to say that all VAs are a little different. So that's one thing, that they're not all going to be the same. However, a lot of their processes are. So first you would want to go and apply for health benefits. And you can do that. We have that in the resources, and that's va.gov/health benefits. And once you're enrolled, then you're set up with a primary care team appointment. And this team helps you in all different phases of your health care. And they'll be able to refer you to other specialty care if needed. So you'll go to your primary care team, and then you'll be referred out from there, whether it's mental health or any other specialty care. So the next step, if you're going to seek mental health care through the VA, is your veteran will probably go through an intake that takes typically between 30 minutes and 2 hours, depending on the VA, because like I said, they're a little different. And from there, they'll get a kind of good grasp on what they think is going on and collaborate with the veteran on what they think the best next step is. Then they'll be referred to that next step. So if somebody is presenting with PTSD issues, they might be referred to the PTSD specialty clinic. So one thing, and I'll probably talk about it in a little bit too, this is where managing expectations is really, really key, because in the PTSD clinic, they might have another intake for the veteran to go through. And that intake might actually ask the same questions that the intake prior was, and you're being asked by a different provider. And so now you're telling your story a couple times to a couple different strangers, and it gets really, really frustrating, and it could get very, very scary, and there's a lot of emotions and aggravating. But I would like to stress that the reason they do that is so that they can make sure that you're getting the right care. And that's the important part. So having that patience and just kind of accepting it up front that, this is what we have to go through to get the best help I can, or that you can, is really important.
Great. Yeah, it is hard to make the initial entry sometimes because not only is there a lot of finding your way to the best, to the kind of help that's really most that fits your needs most carefully. Mm-hmm. But that's also when, you're first struggling with how to articulate and say what your problems are and facing all those feelings. Ashlynn, is there anything you would like to add to discussion about supporting the family member in treatment, or any other thoughts you have about the mental health counseling experience itself?
I think Kristen covered a lot of it. I think the only thing I really want to add and highlight is just the importance as well of the family member making sure that they know it's okay for them to get counseling or seek treatment as well. I know oftentimes they can feel guilty, like, well, I wasn't serving, why should I be having these feelings and thoughts? Or, I think it's really important for them to be aware that we all want to support our loved ones, but in order to do that effectively, our own well-being has to be supported as well. So I think that's just something I wanted to highlight, is just knowing that that's important as well.
I think that that's terrifically important, because all the research shows us that family members who live with a person with these difficulties, whether they're PTSD, and I know that research best, but I think it's probably even as acute or more acute with traumatic brain injury, or the many other problems that people have. That creates a lot of stress, and actually measurable stress reactions and emotional struggles for family members themselves. And so we owe it to ourselves to be kind to ourselves. And if it can be hard to kind of suck it up and say, I need to take care of myself, when you have a family member whose problems look so much bigger than your own. But on the other hand, it's important to remember that if you want to be the most constructive part of that person's future and that person's recovery yourself, it's going to be necessary for you to manage and take care of your own well-being. Because if you're frazzled and your emotions are all over the place, and you're not sleeping, and you're angry, and you're afraid, you're not going to be that best communicator or the person who can kind of stay in there and cultivate that patience and be in it for the long haul. And so getting involved in doing active things to manage your own well-being, and perhaps seeking counseling, is really important. I will just add a couple of things about mental health care, because I think that, we're psychologists, right? We kind of know what mental health care is. It's being demystified for us. And it's easy to forget how regular old people out there, veterans and families, don't know what the heck goes on in mental health counseling. It seems mysterious. God knows what the shrink is going to do, what he's going to ask me, what he's going to find out about me. Actually, mental health counseling is a very practical process. It helps a person to do a lot of very practical things. First, make sense of what you're going through. Learn about what PTSD or brain injury are, how they work, how it can be tackled. As soon as you have a better understanding of something, it strips away some of the negative feelings that we were talking about earlier, about feeling weak or there's something wrong with me. And it makes it seem like a much more matter-of-fact thing that can actually possibly be faced and overcome. Also, in addition to education, there's a lot of coping skills training. That is, people learn skills to cope with the specific difficult aspects of things that are facing them. Some of those are really basic, like how to rearrange your sleep routines and do various things that we found through research can make it more likely for you to sleep well. If you're exhausted all the time, you're not going to be functioning well. If you can do something about your sleep by practicing these new habits, you can do a lot. Also, we've talked about communication problems. Well, a lot of the skills are communication skills. How do I want to express myself with my family? How do I want to talk to them? Some skills are more shrinky, right? They're more psychological. How do I notice and understand my negative thoughts I'm having, my self-blame, my thoughts about my difficulty in trusting other people after war zone service, and finding new ways to react to our own beliefs and change them so they are more helpful to us. Another giant thing that happens in therapeutic counseling, inside VA especially, and in DoD counseling, is meeting and talking with other veterans. Like Ashlynn was talking about this isolation. Well, there are an awful lot of veterans in the same boat as the person in your family. And if a veteran suddenly can get into contact with other veterans who know what they're feeling, who not only know where they came from, but know what they're going through now, and are also struggling, can share strengths and weaknesses. They can support each other and normalize it and give each other support. That's huge. When I've talked with veterans across the years about what was most useful in your treatment, it's almost a routine thing that veterans say, I met those other guys or girls. I connected with them. We are still great friends. We really helped each other through this. Now, there are also some more technical things. You know, I'm a PTSD specialist. The VA is amongst the world's finest institutions in having trained its providers in what are called evidence-based treatments. That is, these are the treatments for PTSD and other mental health problems that have the highest level of research support in the world. If you go in most communities, you do not encounter those treatments because clinicians have not been trained in them. In the VA, people have been trained in those things. So you are likely to get the very treatments that represent the best care we know how to provide right now. And oftentimes that does mean taking a look with a very supportive expert therapist at your own traumatic experiences in the war zone. Treatment typically takes, 3 to 9 months. It's not a thing where you drop in a couple of sessions. Usually you have weekly meetings, hour-long meetings. A lot of the meetings are individual, but also there are a lot of groups where you connect with other veterans and talk about your issues together. VA also has residential treatment programs where you can stay for a few weeks or months to work on yourself. And I will just comment for a minute on VA care. I'm not now an employee of the VA. I retired about 3 years ago. I don't speak on behalf of the VA, but I worked there for 26 years. And across my experience, I found mental health professionals there, psychologists, psychiatrists, social workers, the other helping professions, to be extremely highly motivated individuals. They were not showing up and punching a paycheck. It was a mission. They really cared about veterans. And not only that, and because they worked all the time with veterans, they really got a real sense and a deeper understanding of what the veteran experience was. So in that sense, I really want to recommend that people explore their VA and explore that care. Now, let's take a few minutes here at the last portion of our conversation today to discuss where you on the call can learn more about all of this and where you can find the very best resources that you might need. I'll just mention very briefly 2 resources that have to do with PTSD, but I would say they are also valuable for mental health issues generally. One is the National Center for PTSD website here. The National Center for PTSD is like the National Center for Prevention of Suicide, one of the world's premier resources in the field of PTSD. I would say it is the world's premier organization, and its website is the best website in the world on PTSD. So do not walk to that website if you think your veteran may have PTSD or you know it, because there are segments for veterans and families, and there are an awful lot of very practical questions and issues, and it also will direct you to many other resources. At a more kind of practical level, there are 2 apps that the VA has produced. I'm very proud my organization produced all these apps and about 20 others. But one is called PTSD Coach. PTSD Coach is now being downloaded more than 1 million times, and it is free to you on both the Android or the iPhone platforms. And on it, a veteran can learn about PTSD, learn about helping resources. You can assess yourself using a validated PTSD measure and see how you score. And if you want to see how your PTSD symptoms change over time, you can ask the phone to tell you every week or every month to fill it out again, and it'll graph the changes in your PTSD symptoms. It links you with helping services. It links you with the suicide prevention hotlines that Kristen has been describing should you actually find yourself in need of suicide counseling. But it also teaches you some coping skills. For example, you can learn muscular relaxation training or imaginal exercises to relax. So it's kind of a wealth of good resources, and it's very easy to use, and many veterans swear by it. There's another app called PTSD Family Coach. And for those of you who are on this call who are family members of veterans with PTSD, it's designed for you. Not only does it give you a lot of information about PTSD, well beyond what we're saying today, and also information about how to support your veteran and what happens in care, but it also has a lot of sections on it that help you manage your own stress and keep yourself calm and keep yourself happier. And so we've tried to put our money where our mouth is and build resources that are really easy for you to use that are 24/7. Now, there are a lot of other resources that you can see here on this page. I'm going to turn it over to Kristen to explain some of those.
Thanks, Joe. One that I don't see on here, I'm going to put this in the chat as soon as I talk about it. The first one I'd like to talk about is coaching into care. And the website there is va.gov/coaching into care. And again, I'll put that in the chat in a second. But what this is, it's a national telephone-based support service for family members and others who want to help their reluctant veterans get into care. So they'll actually, it's kind of as it sounds, they're actually coaching you. They can even, I've heard they also can do role plays with you in order to how to start the conversation with your veteran to get them into care. So that's a good resource. Another one, I'll go down the list for ease. The Veterans Crisis Line is there. And this is a 24/7, 365 call, text, chat line. And when you call that number, you press 1, and this supports service members, veterans, and their families in crisis. Or if you don't know if it's crisis and you want to check it out, that's another place to start to give that. And then they patch into your local facilities and get you care that way. Another resource is the VA Caregiver Support Program in the line. So this is for if you're caregiving for a veteran, this is all the support and help and assistance that you could need there. Military One Source is for service members, and it also supports online chat now, which it didn't when I was using it. But this is, it's for the active duty and reservists and National Guardsmen. And they offer a wide range of individualized consultations, coaching, and non-medical counseling for many aspects of a military's life, military member's life. And this includes special needs, adoption, access to care, elder care, relationship building, new parenting, transitioning. So a lot of things that you can get off of that site. Don't Wait, Reach Out is a relatively new resource from the VA that I'm very excited about because it's very, very easy to use. And I love easy to use technology. So when you go to this site, it asks you if you're a veteran, what your top 3 issues are, or if you're a family member, what the top 3 issues are for your veteran. And from there, it provides you a personalized strategy on how to get the help that you need. So for example, if you choose communication issues and financial issues, it'll pop out a list of resources for you to get that help. And that's very self-paced. So that's something that doesn't have to be right away with a crisis line or anything, but that's something you can do kind of over time. Another one I want to, a resource that's really near and dear to my heart are the vet centers. So the vet centers are kind of a branch off of the VA, and they are readjustment counseling services. And they're there to support veterans that have served overseas or in a combat area. So even Navy counts, and because I'm not Navy, I don't know all the specifics, but if they've served overseas, and or if somebody has experienced military sexual trauma, and there's a couple other inclusion criteria there. But these members are eligible for, and their families are eligible for Free for Life, for individual, group counseling, and other services related to that community feel that, Joe, you were talking about in terms of being with other veterans and really engaging in a community that way in order to heal. I think that's it for now. Great. And then we have the Palo Alto University Veteran Military Student Resources site too. That's really helpful. That has all of these and more, I believe.
Now we have a little bit of time for questions and answers. I see 3, and I'm going to, if I may, direct the first to Kristin and the second to Ashlynn. So Kristin, the first one bears on suicide. I'll read it out to you. I continue to be appalled by the high incidence of military suicide and wonder about the role psychotropic medications play, given that suicidality is a known side effect. Who or what body is collecting data on what the military veteran or active serving member was taking at the time of their death by suicide?
That's a fantastic question. So actually, the Center of Excellence that I work at, collects a lot of this data. So when they find out, when any VA finds out that one of their veterans died by suicide, a lot of things go into motion. So a comprehensive chart review happens. There's a lot of, and that gets sent to the Center of Excellence. And so all this data gets compiled and then reports. They're the ones that actually put out the annual suicide reports for veterans every year. And they do a lot of quality improvement that way too. So what do we see are the biggest issues? I would say that the big issue right now is firearm and firearm safety, and making sure that, and that's a big push right now. I think I know something just came down a couple of days ago about making sure that we can safely store our firearms, because this population is more prone to be having them in their arsenal, I guess. So so they take all of that and they compile that and they create new programs because of it. And a lot of the resources that we talked about today are because of that. In terms of the psychotropic medications, I will say that death by firearm is right now I think it's like 60-something% of all suicide deaths right now are by firearms. And so that's kind of the number one priority based on all those reports. But it does come to there's actually a couple different suicide prevention offices across the United States that the Veterans Affairs touches. In Colorado, they have a research facility for suicide prevention, and they do a lot of research there. And then they have other departments that also look at this information.
At the risk of asking you a question that you may not know the answer to, I'm going to ask you anyways, because I think part of the question was there's been kind of talk in the lay press that medications can cause suicide. Is there, according to your knowledge, is there any indication that treatment by mental health psychotropic medications themselves cause the suicide of veterans?
I don't think there's anything resoundingly in the affirmative on that. So that there are risk factors, and risk factors can include mental health diagnoses and medication, chronic pain, lack of sleep, like you're talking about, all those factors related to PTSD and then some, including medication and maybe medication misuse as well. And substance use can all contribute to these risk factors, but taking it from risk factors to the completion of suicide, it's very hard to predict suicide. I wish we could, but that does, in my mind, that goes into the risk factor bucket.
Yeah, and what I would say is that I have not seen a lot of report in the formal PTSD literature about medications causing suicide. In fact, just the opposite. The medications that are evidence-based for PTSD generally are preventive for suicide and help with recovery. I will tell you that talk therapy has more evidence for its impact on PTSD, at least, than medication therapies, but both are very valuable. Now, we have a very different kind of question that I'd like to ask you, Ashlynn, to take a stab at, and then we can all chime in. But what would you do for vets who hate the VA or don't want to use the VA?
Yeah, I think that's a great question. And I think it's important to figure out, what part of the VA do they not like? Why do they not want to use them, right? So figuring out what is this aspect I think talking with other veterans, like I said, can be really useful. I mean, we've had people within our nonprofit who don't want to use the VA, who, for many reasons, sometimes they have issues, getting through for phone calls. They can be impatient and just like, well, I didn't get through. I don't want to call them back. Or we've had issues with getting to the VA, right? Like, it's too far from where I live. I can't drive. I don't have a car. So what is the aspect of it that they don't like? Is it the actual part of it? Is there something that we could do by having family members help, or nonprofits, organizations that could help give rides or help with financial assistance? But I think the VA has so many resources, like we just talked about. So I think it's really important to figure out, what is it about it that they don't like, and where can we navigate from there? Can we help find other resources for them, that for people who do help, with PTSD or with any other trauma, right? So I think for me, that's one of the biggest things, is just finding out, what is it about it, and where can we go from there?
Yeah, thanks for that. I will tell you, I'm going to give you my opinion here. My opinion is that much of the anti-VA feeling that does exist in some sectors of society, I think is largely not building on what is actually the case in VA. In other words, I think that there are a lot of negative beliefs about the VA that aren't very grounded in what actually takes place there, which is not to say the VA is a perfect institution. And again, it's not my job to defend the VA, but I would argue that the VA is by far, head and shoulders, the best mental health treatment organization for PTSD and the other problems experienced by returning veterans. I think it's head and shoulders above the private sector. And at the risk of offending my colleagues, I would say it's almost certainly better in many respects than what happens in active duty service. And however, we don't need to take that on, right? It's sometimes those ideas are very entrenched. And so there are many places that a veteran can go for help. By the way, Kristen talked about the vet centers or the readjustment counseling service. That is something that, yes, the VA system offers, but it's not part of the healthcare system. It is a system of storefront centers manned primarily by veterans themselves who work in these places. So it doesn't have all the trappings of all the medical treatment. It's a wonderful resource. There are also other private clinics that are in existence that are serving veterans. So the most important thing is to go for care. But I do hope that many people will reevaluate their negative view of the VA. Now, we have another couple of questions, which is a really interesting one. How is moral injury addressed in clinical settings? Is there any difference in the approach to PTSD treatment when moral injury is an apparent stressor or barrier to treatment? And maybe I could take a crack at that one. So moral injury is a concept that has come into play in the last 10, 15 years. Before that, it was understood to be there, but it didn't have a word. And what it means is that, a lot of the experiences we have always considered to be traumatic to lead to PTSD are experiences with fear of dying, of seeing other people close to us die, things like that. But the other major stressor, which can take place in war zones, is a feeling like you as a combatant or personnel in a war zone have somehow broken a fundamental moral rule for your life. So this can happen in a lot of ways. It can happen because a combatant will witness the death of civilians and come to view the war differently, or a person may make a mistake in a situation and label themselves as having transgressed something, one of their moral, deeply held values. Those things are common in trauma and are especially common in war. So now psychology has developed a lot of moral injury interventions. Many of you may have heard of cognitive therapy. Cognitive therapy is a kind of psychological counseling. Well, what we do is we say, we know that veterans and others make sense of their of their war experience. They draw conclusions. They have beliefs about what they did and they didn't do. Some of those beliefs are very troubling, like I can't trust other people. The world's a terrible place. The world is extremely dangerous. And some of them have to do with moral beliefs, right? So the belief that I've offended God, that I am not worthy to live on this earth anymore because of something I did or did not do. So now we apply cognitive therapy. We help a veteran take a look at those beliefs, hold them up in the fresh air, evaluate them honestly from all angles, what makes sense, what does not make sense, what may be a little bit exaggerated, more extreme, how would other people look at it? And very often in that process, healing things can happen. So it is something that needs to be included in care, but certainly in the places that specialize in veterans with PTSD and other war-related issues, there's a lot of familiarity with moral injury, and there are even specific kind of psychological interventions and techniques that are designed to tackle those things. I don't know if my colleagues want to answer anything. There's another question, but if you want to add to any of these questions, Rebecca or Ashlynn, anything that you want to comment on?
Joe, I just wanted to say that there's another question in the chat that I think might be, we'll see how much time we have left, but
Yeah,
I really
why don't
like
you go for it? Why don't you go for it?
I've worked with veterans for several years, and as a civilian, it is hard to express gratitude for their service without being offensive, while also expressing I am a civilian. How do you express or introduce yourself as a supporter or and having desire to help? I actually introduce myself and say, this is my way of being of service to you for the service you have provided me. So I think that's a really important question too, as we're talking about this, and how that the meaning of thank you for your service, especially as we're coming up on Veterans Day, can mean different things to different people. The Vietnam era were never thanked for their service during that time. And so thanking them, and I'm not saying for everybody, but usually thanking them for their service has a little bit more meaning behind what it is, what it means today for it. And again, I'm not speaking for I'm just speaking from personal experience. But I think, Robert, in my view, and I'm interested to hear what Ashlynn and Joe too, on how you approach this. But back to authenticity and being genuine and not feeling sorry for not having served. There's nothing to apologize for not serving. I think, you serving now and helping veterans is enough. So don't feel like you have to ingratiate yourself. I think just, being open and honest and transparent is doing the right thing. But Joe and Ashlynn, I'd like to hear what you have to say about it.
Ashlynn, anything that you would like to comment on to that question or any other one?
Yeah, I think in regard to that question, I mean, based on with my dad and what we've experienced, and I think my dad might be a special case, but he really does not like for people to know that he's a veteran. He doesn't like to, put it out everywhere, especially if we would go to a thing that's oh, if you're a veteran, stand up. He doesn't like to make it known. He likes to be very on the down low kind of about things. And so I think too, when people, because he has had bad experiences with this, where if people do find out, they kind of are over the top. And sometimes it makes him feel he doesn't want to think his whole life is all about that. He wants to still be himself and not just be I'm a veteran, and everyone he comes into contact with is almost over the top praising. And so I don't know, it could just be my dad, but we've had that experience where he's just when I go into a social situation, I don't want to be just known as, the veteran of what I've done, where I've served and all of that. So sometimes I think just keeping it genuine, like Kristen said, and just kind of keeping it just simple. Because when it can be over the top, sometimes it really can come across, not come across well, even though it may have good intentions behind it, if that makes sense.
Well, thank you both for your comments on that. I think that's an important issue, especially on Veterans Day. So I want to honor our time agreement. We're at the end of our scheduled time today. Thank you all for joining us. We hope it was helpful for you, and we hope that it will at least add something to your toolkit on how to help your veteran, or if you are a veteran yourself, we hope it will have given you some ideas about things that you can do to make sure that you are doing well and feeling good about your life here after your service. I want to thank as well our two panelists, Dr. Kristins Background and Ashlynn Steinball, for a very informative discussion, and also particularly for opening yourselves and telling us a bit about your own personal experience. It's a real treat to have your psychological expertise combined with your firsthand experience. Be able to find this panel discussion and other similar discussions in our series on Palo Alto University's YouTube channel. And if you have any further questions, please feel free to email externalaffairs@paloaltou.edu. externalaffairs@paloaltou.edu. Happy Veterans Day, everyone. Thank you for attending, and great good fortune as you go forward. Bye-bye now.